Jamaica health system in crisis and no one wanna be held accountable, my people. No transparency, no accountability. Leave people in crisis more and more every day. Now the nurses on the street demonstrating over the weekend, my people. Dr. Alfred Dawes speak on the corruption and nepotism and cronyism that taking place at University Hospital of the West Indies, while Daryl Vaz apologize to the people for bringing misinformation to the parliament. Angela Brown-Burke disagree with the Roper Act and voice her opinion on a very harsh way. So my people, let's get into it and hear what they got to say, and leave your thoughts and views in the comment section and let us have that honest discussion. Let's get into it.
First of all, there is overcrowding. There are currently over 100 patients in the area and it's supposed to house maybe about 35. Yes, and my nurses have to code patients that is provide resuscitative care on the floor. That is inhumane. And at this time, the nurses just cannot take anymore. We even have some rodent infestation. They have communicated before and we still haven't gotten a response. So this morning, we need to take some action and we are doing it today.
Welcome to the first episode of what promises to be a critical conversation about one of our nation's most vital institutions. I'm Dr. Alfred Dawes, Shadow Minister of Health and Wellness and a graduate of the University of the West Indies Medical School and a former chief resident in the Department of Surgery at the University Hospital. And over the coming days, we'll be taking you through a disturbing journey, one that exposes how the University Hospital of the West Indies, a beacon of Caribbean healthcare excellence, has been brought to its knees by mismanagement, corruption, and a fundamental betrayal of public trust. The recent revelations in the Auditor General's report are not just numbers on a page. They represent lives affected, resources squandered, and a healthcare system pushed to the brink. Today, let's start at the beginning with the history of this great institution, its regional importance, and the crisis it now faces. To understand what we stand to lose, we first must understand what the University Hospital of the West Indies truly represents. In 1945, in the aftermath of World War II, the Committee of Higher Education in the colonies made a transformative recommendation: establish a university in the West Indies. Jamaica was chosen as a site, and critically, it was decided that the first faculty should be that of medicine, as there was a desperate shortage of medical professionals throughout the region. In October 1948, the University College of the West Indies, affiliated with the University of London, opened its doors with its first cohort of medical students. On January 18, 1953, Sir Winston Churchill himself toured the hospital. The message was clear. This was an institution of international significance, deserving of international support. The UHWI is not just another hospital. It is the first teaching hospital in the entire Caribbean region and an internationally recognized academic institution. It serves as the premier regional referral center, providing other Caribbean countries with an affordable option for critical services. When medical students from across the English-speaking Caribbean seek world-class training, this is where they come. Today, the hospital operates 579 beds and is classified as a Type A regional referral hospital, the highest classification. Each year, an estimated 10% of the Jamaican population visits the hospital. But beyond Jamaica, UWI's impact radiates throughout the region. It graduates more than 300 healthcare workers annually at the undergraduate level and almost 40 specialists at the graduate level through the Faculty of Medical Sciences. These professionals don't just serve Jamaica. They return to Barbados, Trinidad, Grenada, Belize, Guyana, and every corner of the English-speaking Caribbean to provide medical care in their home countries. This is the institution that made me, as well as my colleagues, be able to serve you, This is what we stand to lose should we continue down this road. The Ministry of Health and Wellness itself has acknowledged that cases of chronic non-communicable diseases such as diabetes, hypertension, heart disease, and kidney disease continue to burden the facility, causing chronic overcrowding and ward space problems. This isn't a new problem. As far back as 2017, reports warned that the overcrowding at the UHWI could cost the hospital its accreditation to train doctors and nurses. Resident doctors have written formally to management describing working conditions that fall below acceptable standards for a tertiary teaching hospital. They document that doctors currently lack adequate on-call rest facilities and functional beds, furniture, and even refrigerators. They state bluntly, these conditions fall below acceptable standards for a tertiary teaching hospital. In detailed internal memos, staff outline what they call long-standing infrastructural and supply challenges. Defective and unused beds, over 30 of them on the medical wards alone. Severe overcrowding in the emergency department experienced by every patient and relative who visit. And this happens despite available ward spaces. The closure of the medical annex for over 17 months and recurrent shortages of basic items such as stationery. There are periodic shortages of essential medications and an inconsistent availability of blood tubes and IV fluids. Critically inadequate supplies of something as simple as betadine contribute to contaminating blood cultures and prolonged admissions due to inadequate antibiotic coverage. There are shortages of contrast and injector syringes in the radiology department, affecting the ability to get CAT scans. Consultants themselves have raised serious concerns about procurement priorities, writing, despite the lack of basic equipment and supplies, there seems to be a strong motivation by the hospital management to procure items that have not been requested by senior medical staff. They describe expensive imaging equipment purchased or leased without the requisite plans for regular maintenance, and note that even when equipment exists, restricted access to portable x-rays and insufficient access to C-arms in the operating suite is not being facilitated in an equitable manner. Meanwhile, they report that our work is being hampered by a lack of basic items such as air conditioning within the main operating theatre, defibrillators, and the provision of basic gases. They add that frequent calls by the consultants are largely being ignored. On accountability, consultants raise the alarm that UHWI is a fee-collecting entity for radiology services and pharmacy retail. Yet, no definite accounts with respect to hospital income from these activities seem to be forthcoming. Only rough estimates seem to be provided in reports by the hospital management, despite the presence of a billing office and an accounting department at the hospital. They wrote, this raises questions regarding the financial and accounting practices of the hospital. Consultants also requested basic transparency. The consultants wish to have further information regarding what the procurement process entails. For example, who are the persons responsible for generating the needs list that guide the procurement process? Information is required regarding whether members of staff, such as the consultants, have any say in what items are required and hence ordered. Are the procurement documents available as public records, past and present? Regarding clinic space, staff documented that there is a persistent shortage of functional clinic spaces at least 3 days per week. Several clinic cubicles are non-functional and some also lack working computers. With the recent addition of structural cardiology and stroke clinics, existing clinic space is no longer adequate to effectively accommodate patient volumes. The Department of Medicine residents stated, we must state clearly that it is unreasonable and unsafe to expect staff to continue under these conditions for another month. These are not the words of politicians. These are the words of the people on the ground, consultants, residents, and interns documenting in black and white how failing infrastructure and ignored complaints are putting patients and staff at risk. This is where we arrive at the heart of the crisis. It's not just that UHWI needs more resources, it's that the resources that have been allocated are not being used properly, transparently, or in the best interests of patients and the institution. The Auditor General has now confirmed what staff have been saying. The performance audit found that UHWI could not produce procurement documentation for 51 contracts valued at $521 million, making it impossible to verify whether the hospital got value for money or complied with the law. The same report exposed the misuse of the hospital's tax-exempt status to import goods for private entities, depriving the state of millions of dollars in revenue. So while doctors are begging for basic supplies, functioning beds, defibrillators to save lives, and safe spaces to rest, hundreds of millions of dollars are flowing through a system that cannot even produce the paperwork to show what was bought, from whom, and why. When a hospital designed for 579 beds is admitting 120 to 150 emergency patients per day, what does that look like? It looks like patients lying on trolleys in hallways, family members standing for hours because there are no chairs, nurses trying to monitor multiple critically ill patients simultaneously because the wards are overflowing, and doctors making impossible decisions about who gets the limited ICU beds available and who they must let die. The UHWI does not exist in isolation. It's a part of the University of the West Indies, which serves 18 English-speaking countries and territories in the Caribbean. UWI is consistently ranked among the top universities in the developing world, and its medical faculties are central to training the region's healthcare workforce. When UHWI struggles, when it loses credibility to procurement scandals and governance failures, it doesn't just affect Jamaica. It affects the reputation of UWI. It affects the ability of Caribbean medical graduates to secure residency positions internationally. It affects the willingness of international partners to collaborate on research. It affects everything. When this institution is compromised by corruption and mismanagement, every country in the Caribbean suffers. You cannot restore public trust with more press releases, panels with obscure terms of references, and ribbon-cutting ceremonies. You need systemic reform. Today, we stand at a crossroads. On one path lies continued decline, an institution that slowly loses its regional accreditation, its ability to attract top faculty, its capacity to provide world-class care. An institution that becomes known not for its medical breakthroughs, but for its procurement scandals, where the brightest Caribbean minds choose to train elsewhere because they've lost faith in its future. On the other path lies renewal, but only if we demand accountability, transparency, and fundamental reform. Only if we insist that those responsible for the failures detailed in the Auditor General's report face consequences. Over the coming days, we'll dive deeper into each aspect of this crisis. In the upcoming episodes, we'll examine the HR crisis, staff complaints, controversial transfers, shortages in critical departments, and what it all means for patient care. In subsequent episodes, we'll explain exactly how procurement fraud works, who benefits, and why it is so hard to detect. We'll trace the networks of influence that have allowed this to happen. We'll provide a detailed analysis of the Auditor General's findings, and ultimately, we'll present a roadmap for saving the UHWI. I'm Dr. Alfred.
Now that's to hear what the nurse got to say and what Dr. Dawes got to say. What is your thoughts and views on all of this, my people? Leave them in the comment section. Let us have that honest discussion. So let's get into it and hear what Angela Brown-Burke got to say.
Thank you, Mr. Speaker. Mr. Speaker, I want to start with just a couple of comments as it relates to motion number two, which has to do with the amendment to the Representation of the People's Act. I want to say that it is obvious that the member has taken some time to look at the process of election and to look at some of those areas that are troublesome and that need attention. I must say that for the second one, which is the one I'm talking about, which really deals with introducing other implements other than the black lead pencil to be used to make a mark for the candidate, and also where it refers to also introducing other marks that could signal the choice of candidates. I must say that I vehemently oppose both, and I'll tell you why. At first glance, it sounds like something that makes sense and that is easy to do. However, in my head, I am still very clear of the Jamaica in which I live. And I am also very clear that we still talk about the golden ballot. We still talk about individuals who pay persons to come in and vote a particular way. And who, no, I tell you, Moran Bay teaches me well. No, Moran Bay by-election teaches me well. And it wasn't on this side that those things were happening. So let us be very clear, very clear. And so, my concern, Mr. Speaker, is that we could be in an election, for example, like the by-election in Moran Bay, and individuals from the other side pay individuals, pay voters to go into the polling station and to make a mark in a particular way. Because we have now made the changes for a specific mark to be used. It would then clearly identify, let's say, of the 20 persons that you have targeted to get a vote in a particular way, you would be able to say 18 of them delivered because they had that specific mark, or because they went in and used a specific implement. When individuals in this very house presented candidates who were either Israeli citizens, US citizens, yes, born in England, yes, knowing and agreeing on the two major qualifications, none of which they would have violated. So we are good. But what they have done with a brave face of hypocrisy is to stand on that and turn around and look at someone that they know very well, went to school in Jamaica, went to school with many of them, born here, not even his birth certificate as Jamaican was able to staunch the criticism from those hypocrites who were putting forward candidates who were in the same position, if not worse. In fact, worse is in fact that member who as is shown allegiance to the US, but sat in this parliament, yes, with the cover of the hypocrisy from her colleagues. And then you have the effrontery, and then you have the effrontery to present before us this motion number 7 as if you really have it at heart, the real protecting the Constitution and protecting Jamaica. Rubbish. And I am saying that those individuals who support motion 7 or who bring this motion to us, them should have burned in fire and burned in hell.
Big success story of the restoration, and that is the JPS and the electricity restoration. First of all, as committed yesterday in Parliament, let me clarify a particular statement that I made in Parliament yesterday, which turned out to be erroneous information given to me by the Jamaica Public Service, where I indicated that in one instance, 40 miles of lines were rebuilt with over 1,000 poles from Ferris Cross to Hodges, Westmoreland to St. Elizabeth, to restore approximately 2,000 customers. That information was incorrect. Work has started with 100 poles that have been laid so far out of the total amount of 1,000 poles. It's about 40 miles of roadway. So it will take some time, but again, the work has started. So I want to apologize for the misinformation that was given in Parliament, and I will make sure that it is corrected on Hansard, and also to say very clearly that the information that I stated was erroneous and incorrect. And the information was given to me by the Jamaica Public Service. Nobody needs to ask the words that JPS and I had about this. And I can assure you it will never happen again.
That's all for now, my people. What is your thoughts and views on all of this? Leave them in the comment section and let us have that honest discussion. New viewers, forward to the avenue. Don't forget to like, comment and share. Watch the videos to the end. Subscribe to the channel. I'm out. Thank you for watching.